Hello, second year GNM students. Here is your important questions from Medical Surgical Nursing. So this exclusive question paper is only for you. So first we will see how the pattern of the questions. So first let's see. So it is a 3-hour exam. You have 3 hours to write and you will get the maximum score of 75 marks. And first category of questions we are going to discuss is give the meaning of following words. So you'll get 4 words to write the meaning or definition. So here the questions are radiotherapy, labyrinthitis, arrhythmias and hemophilia. So the second category of questions you will get, that is fill in the blanks questions. So here the questions are inflammation of the cornea is called what? Then acute peritonsillar abscess is also known as, simple fracture is also called as what fracture? Inflammation of the breast is known as dash. So these are the fill in the blanks questions you can expect over your exams. So next category of questions will be write short notes of any 4 of the following. So you need to write the short notes of this question. So first is refractive errors, role of nurse in disaster management, anemia, pericardial effusion, hypertension. So these are the example or model questions. So next category of questions will be answer the following questions. So what are the questions you can expect? Define endocarditis, explain the medical, surgical and nursing management of endocarditis. Explain the medical, surgical and nursing management of endocarditis. Next question is list the causes and clinical manifestation of congestive heart failure and explain the medical and nursing management of patients with CCF. So these are the pattern of questions. So continuing, next category of questions will be state whether the following statement is true or false. You will get 4 true or false questions. So the middle layer of heart is called myocardium. Abnormal sensitivity to the light is known as photophobia. Montauk's test is done for diagnosis of diphtheria. Exposure to strong acid causes thermal burns. So think students. So what will be the answer? Either the statement is true or false. So now next category will be write the short notes of any 4 of the following. So you'll get defibrillator, principles of emergency care, typhoid fever, osteoporosis, prevention and management of AIDS. So these are the example questions. So next category and the last category will be answer the following question. So here define coronary atherosclerosis and list the clinical manifestation and diagnostic evaluation of coronary atherosclerosis. Next question, explain the medical and nursing management of coronary atherosclerosis. Define burns, list the type of burns and write the nursing management of patient with major burns. Now, let's discuss the answers of these particular questions one by one. So the first one is give the meaning of following word. What was radiotherapy? It's a treatment of cancer using high energy radiation to destroy the cancer cells and shrink the tumors. So radiotherapy is a treatment type of cancer treatment where we are using high energy radiation to destroy the cancerous cell or shrinking the tumor. So that is radiotherapy. So second question was labyrinthitis. So it is the inflammation of inner ear called labyrinth. It is the inner ear inflammation. It will cause vertigo, dizziness, nausea and hearing problem. So that is labyrinthitis. It is the inner ear inflammation. So third question was arrhythmias. It is abnormal heart rhythm. So it is abnormal heart rhythm where the heart beat too fast, too slow or irregularly. So that condition is known as arrhythmias. So the fourth question will be hemophilia. So what is hemophilia? It's a blood disorder. It's a hereditary bleeding disorder in which blood does not clot normally due to deficiency of the clotting factors. Due to deficiency of clotting factors, the blood does not clot normally after an injury. So that is condition is hereditary bleeding disorder known as hemophilia. So this is the meaning of that 4 words. Now we are continuing with the second category, fill in the blanks. So inflammation of cornea is called keratitis. So the inflammation of cornea is known as keratitis. Acute peritonsillar abscess is also known as quinsy. So it is also known as quinsy. Simple fracture is also known as closed fracture. And the inflammation of the breast is called mastitis. So this is the fill in the blanks questions and its answers. The third category was write a short note of any of 4 of the following. So you will basically get 5 questions. You need to write 4 of the questions answers. So the first is refractive error. So what is refractive error? It is a defect of vision. So it is affecting the vision. Defect of vision in which light rays do not properly focus on the retina, resulting in blurred vision. So the light rays could not focus properly on the retina, causing blurred vision. That is what known as refractive error. So there are types will be there. First is myopia, that is short sight. Distant objects appear blurred. So the person who is having myopia, their distant objects will be blurred. So that is myopia. Next is hypermetropia, or also known as long sight, where near objects appear blurred. So they can't see the near object, it will be appearing the blurred. Next is astigmatism. It is distorted or blurred vision due to irregular cornea. Due to irregular cornea, distorted or blurred vision, that is astigmatism. Next is presbyopia. It is age-related difficulty in near vision. So these are the 4 types of refractive errors. Next we will see the management corrected using spectacles, contact lenses, refractive surgery. So we can correct this through specs. We can wear the specs, lenses, or through refractive surgeries. So next question we are going to discuss is role of nurse in disaster management. So what is role of nurse? First one, preparedness. So participate in disaster planning, drills, and education, maintain emergency supply. So that is the preparedness. Next is assessment and triage. So rapid assessment of victim, prioritize care based on the severity of injuries, emergency care. So provide first aid, life-saving measures, wound care, and infection control. Next will be coordination, work with the disaster response team and communicate effectively. Psychological support, offer emotional support and crisis counseling to the victim and families. Then rehabilitation and follow-up, assist in recovery, rehabilitation, and health education. So this is the role of nurse in disaster management. So next question is anemia. So what is anemia? It's a condition which there is decrease in hemoglobin level or red blood cells. So there is reduction in the hemoglobin or red blood cells, resulting in reduced oxygen carrying capacity of blood. So the blood has less oxygen carrying capacity. So that is the condition where there is decreased hemoglobin level or red blood cell levels. So what are the clinical features? Pallor, fatigue, weakness, breathlessness, and dizziness. So what will be the management here? It is treat the underlying cause, iron and vitamin supplementation, blood transfusion in severe cases. So this is anemia. It's a condition where there is decrease in the hemoglobin level or red blood cells. So the next question will be pericardial effusion. So what is pericardial effusion? It's accumulation of excess fluid in the pericardial space surrounding the heart. So it is the heart has a pericardial surface or cavity. So the excess accumulation of fluids in the pericardial sac is known as pericardial effusion. So what are the causes? Infection, tuberculosis, trauma, malignancy, heart failure, and post-myocardial infarction. Clinical features include chest pain, breathlessness, muffled heart sound, and tachycardia. And the management include treat the causes, monitor vital signs, pericardiocentesis in the severe cases. So this is about pericardial effusion. Next category of question is hypertension. So it's condition which the blood pressure is persistently above normal, usually more than 140 by 90 mm of Hg. And what are the causes of hypertension? So primary or essential causes include hypertension, secondary causes like kidney disorders and endocrine diseases. Clinical features, often it is asymptomatic, then also headache, dizziness, and palpitations will be present. Management, lifestyle modification, low salt diet and exercises, antihypertensive drugs, and regular BP monitoring. So as a student, while you will writing the exam, you need to elaborate the points and write in detail. So the next question we will see, answer the following question. So here, the first one is define endocarditis. So what is endocarditis? Inflammation of the inner lining of heart, that is endocardium. So inflammation of inner lining of the heart, that is endocardium. It's known as endocarditis, usually involving the heart valves caused by infection. So next question will be explain the medical, surgical, and nursing management of patients with endocarditis. So here, management include prolonged anti-IV antibiotics based on the blood culture and sensitivity, antipyretics and analgesis, management of complications like heart failure and embolism. Then surgical management include valve repair or valve replacement in the severe cases of valve damage, heart failure, or persistent infection. So in the persistent infection or heart damage or a valve damage, then we will go for valve repair or valve replacement surgeries. Coming Coming to the nursing management, monitor vital signs, heart sound and temperature. Administer antibiotics as prescribed and observe for the side effects. Maintain strict asepsis to prevent further infection. Provide rest, nutritional support and patient education. So this is the nursing management of endocarditis. So next question we'll discuss about list the causes and clinical manifestation of congestive cardiac failure. So what are the causes here? Hypertension, coronary artery diseases or myocardial infarction, valvular heart disease, cardiomyopathy, congenital heart disease, arrhythmias and severe anemia or infection. So coming to the clinical manifestation, dyspnea, orthopnea, proximal natural dyspnea. Then fatigue and weakness, peripheral edema, pulmonary congestions like cough and crepitations, tachycardia, raised JVP, jugular venous pressure, then hepatomegaly and ascites, decreased urine output or oliguria. So these are the causes and clinical manifestation of CCF. Now coming to the medical and nursing management of CCF include medical management, diuretics to reduce the fluid overload, AC inhibitors or ARBs to decrease the cardiac workload, beta blockers to improve the heart function, digitalis to increase cardiac contractility, oxygen therapy for hypoxia, salt and fluid restriction. So coming to the nursing management, it include monitor vital signs, intake output, daily weight, then position patient in semi-furloughs to relieve dyspnea, administer medication as prescribed and observe the effects. Restrict sodium and fluids, provide small frequent meals, assess for edema, breath sound and activity tolerance and provide patient education and emotional support. So next we will see, state whether the following statement is true or false. You need to write 4 questions, true or false questions. Don't need to write the full sentence, only need to write true or false. So the first sentence for the middle layer of heart is called myocardium. It is a true statement. So the answer is true. So it is the heart's middle layer is called myocardium. Abnormal sensitivity to light is known as photophobia. Yes, it is true. The person who have abnormal sensitivity to light, it is known as photophobia. Then Montauk's test is done for diagnosis of diphtheria. No, it is not done for identifying tuberculosis. Then exposure to strong acid cause thermal burns, it is a false statement. So this is the answer for true or false questions. Now let's discuss about write a short note of any 4 of the following. Here also you need to write the short note. So the first question is defibrillator. So what is defibrillator? It's a medical device used to deliver controlled electric shock to the heart. So it's a device we are using to give controlled shock to the heart to restore normal rhythm during life-threatening conditions like arrhythmia such as ventricular fibrillation, pulseless ventricular tachycardia. So here you can see in the movie Raja Rani, if you have seen, there is where Nasriya will get a shock from the defibrillator. So that's an example where defibrillator is a medical device used to deliver a controlled electric shock to the heart. So here, what are the types? It is manual defibrillator and automated external defibrillator. 2 types, manual and automated external defibrillator. Next, we will see the uses and nurse's role. Uses include cardiac arrest to re-establish the effective heart rhythm. And nursing role, ensure safety, monitor ECG and assist in CPR. So next question we will discuss about principles of emergency care. So what are the principles? Rapid assessment of patient, priority based care using ABC approach. What is ABC approach? Airway breathing and circulation approach. Immediate life saving interventions, stabilization of vital signs, prevention of further injury or complications, continuous monitoring and documentation, timely referral and transport when required. So this is the principles of emergency care. So next we will discuss about the next question, that is typhoid fever. So what is typhoid fever? It's an acute systematic infectious disease caused by Salmonella typhi transmitted through contaminated food and water. So it's a infection caused by Salmonella typhi and it is spreading through contaminated food and water. What are the clinical features? Prolonged fever, headache, abdominal pain, diarrhea or constipation and weakness. So next is management, antibiotic therapy, adequate fluid, antipyretics and nutritional support. Prevention, safe drinking water, proper sanitation and typhoid vaccination. So the next question we will discuss about osteoporosis. So what is osteoporosis? It's a skeletal disorder characterized by decreased bone mass and density. So here decreased bone mass and density will be there. So it's a skeletal disorder making bones fragile and prone to fracture. So who is having osteoporosis, their bones are prone to get a fracture and other dislocation. So they are mainly prone to get fractures. So what are the risk factors? Aging, postmenopausal stage, calcium and vitamin D deficiency, sedentary lifestyle. So what will be the clinical features? Often asymptomatic, back pain, fractures and loss of height. Management, calcium and vitamin D supplementation, weight bearing exercises, medication like this, biophosphonates. Medications like biophosphonates. So these are the management of osteoporosis. Now let's discuss about the next question, prevention and management of AIDS. How we can do the prevention and management of AIDS? First is prevention, practice safe sex, use of condoms, avoid sharing needles or syringes, screen blood and blood products before the transfusion, mother-to-child transmission prevention with ART during pregnancy. So that is antiretroviral therapy. Health education on hygiene and infection control. So what is the management? Antiretroviral therapy to control HIV infection. Treat opportunistic infections promptly. Provide nutritional support and psychological counseling. Regular monitoring of CD4 count and viral load. And also educate on adherence to therapy and lifestyle modification. This is prevention and management of AIDS, acute immunodeficiency syndrome. It's caused by human immunodeficiency virus. So the last category of questions we will discuss is answer the following questions. So here 27th question will be define coronary atherosclerosis, list the clinical manifestation and diagnostic evaluation of coronary atherosclerosis. So it's a hardening and narrowing of the coronary artery due to accumulation of fatty deposits on the inner walls leading to reduced blood supply to the heart muscle. So it's a condition where there is hardening and narrowing of the coronary due to why the narrowing and hardening? Because of the fat deposits on the either the wall of the blood vessels. So it will cause reduced blood supply to the heart muscle. So that is coronary atherosclerosis. So here consider this is your blood vessel. So it is normal blood will flow. Sometimes what happens? The fat will be accumulating in the both sides. So the blood flow will be reduced. So that is condition is known as coronary atherosclerosis. So what are the clinical manifestation? Chest pain on assertion or also known as angina pectoris. Shortness of breath, fatigue and weakness, palpitation, myocardial infarction in severe cases like heart attack in the severe case. So, diagnostic evaluation, electrocardiogram, ECG or EKG, echocardiography, coronary angiography, stress test or treadmill test, and blood test like lipid profile, cardiac enzymes in MI is suspected. So, if the MI is suspecting in the case, we need to go for the cardiac enzymes test also. So, now let's discuss about the medical and nursing management of coronary atherosclerosis. So, it includes lifestyle modification, low fat diet, regular exercise and smoking cessation. Medical management include antiplatelets, aspirin to prevent clot, statins to lower the cholesterol, beta blockers or nitrates to relieve angina, revascularization procedure, angioplasty or coronary artery bypass graft, CABG, or also known as bypass surgery. So these are the management, medical and surgical management. Coming to the nursing management, monitor vital signs, ECG and symptoms of angina. Administer medication and observe for the side effects. Educate patient on diet, exercise and smoking cessation. Provide emotional support and stress management and prepare and assist patient in diagnostic and surgical procedures. Next question, 29th question, that is define burns, list the type of burn. So what are the burns here? Burn is a injury to the skin and underlying tissue caused by heat, chemicals, electricity, radiation or friction. So it either due to heat, chemicals, electricity, radiation or friction. It is the injury of skin and underlying tissue is known as burns. So what are the types? Thermal burns caused by heat sources like fire, hot liquid, steam or hot objects. So that is thermal burns. Next category is chemical burns caused by acids, alkalis and other corrosive substances. Next is electrical burns resulting from the contact of electrical current and lightning. Or radiation burns caused by exposure to UV rays, X-rays or radioactive substances. Next is friction burns. Friction burns caused by skin rubbing against the rough surfaces. So these are the types of burns. So the last question is write the nursing management of patients with major burns. So what are the nursing management? Airway and breathing, ensure patient airway, give oxygen, monitor respiratory status. Then circulation, maintain fluid balance, monitor vital signs and start IV as prescribed. Wound care, cleanse burns, apply prescribed dressings and prevent infection. Pain management, administer analgesics, provide comfort measures. Nutrition, provide high protein, high calorie diet to promote healing. Monitoring, observe for signs of shock, infection and organ dysfunction. Psychological support, reassure patient and provide emotional support. Rehabilitation, assist in physiotherapy, prevent contractures and promote mobility. So these are the role of nurse in the management of burns. Now, let's check some of the important topics from the medical surgical nursing part 2. So, what are the important topics? Let's see. So, the questions will be side effects of chemotherapy, refractive errors, nursing management of patients with psoriasis, nursing management of patients having plaster cast, then prevention and management of chickenpox, amputation, mastitis, mastoiditis, angina pectoris, nursing management of patients with hypovolemic shock, management of adverse reactions of blood transfusion, atherosclerosis, hemophilia, role of nurse in disaster management, and radiation therapy, management of patients with deafness, prevention and management of patients with COVID-19, otitis media, cataract, care of patients with cardiac catheterization, varicose vein, dermatitis, care of patients with tracheostomy, type 4 fever, glaucoma, food poisoning, retinal detachment, deviated nasal spectrum. So when you study all these questions, you will cover your most of the syllabus from medical surgical nursing. So I hope everyone understood. Keep learning, keep growing with easiness where nursing education made easy, and all the best for your exams. Thank you.